Okay, so here we have Dr. Abbas Shobeiri. I have the fortune to have him here in the first international summit on the pelvic floor imaging. Doc, thank you very much to be here in this very interesting project we are starting off. So I'd like to ask you some questions.
Thank you.
So, according to your experience, you have a lot. You told me about 30 years back you started doing pelvic floor ultrasound. So, which area in the healthcare and the medicine is currently underestimated? So, what will be the best impact in the next years, 10 years?
Well, obviously, I'm interested in women's health, and I'm interested in pelvic floor disorders. So I think when we narrow it down to that area alone, I think it would be great if we could harness AI so we can get imaging into the hands of more practitioners out there, and also stress and regenerative medicine is probably what I would be looking for.
Okay. So, the most women we see ourselves that we deal with pelvic floor anatomy, we see almost people over 50 years old, 80, 60, 70 years old. Most of this problem starts very early age. It starts from delivery, the first delivery. So what do you think we should do? We should change our practice to diagnose the problem at that age, not waiting up to 60, 70. I don't know if think we can change, but our responsibility to diagnosing this type of problem early. So what do you say about it? Should we changing that practice?
Yeah, I'm just smiling because the average age for my patients is probably 34.
Okay.
So I have made that transition already, where all the patients are seeing that I'm seeing are postpartum.
That's great. Here in Latin America, we're in Mexico and long ways to the Argentina, that's difficult to do. That's difficult because there is no culture in the prevention culture. So we are working hard to change it, really by getting people old age. One of my commitment also is trying to get that patient early age and see what we can do on that.
I think you are not alone. I think the practice that we have is very unique in the world, and even in the US, I don't think the practice is any different from Mexico or Argentina. The average urogynecologist is seeing patients who are 55 to 75. So I think I'm an outlier, but I just answered your question, really what it takes. Yeah.
It takes a lot of work to do.
Correct.
To convince the people that they should come earlier to see that.
Well, the people would not know any better. I think the providers that are seeing the patients, whether they're OBGYNs, other urogynecologists, physical therapists, colorectal surgeons, those are the people who need to say, well, we need to refer you to this group of people or center that specializes in this.
So, what do you do to change that practice from the 50 years to 34 years? What is the hard work you have to do to convince the other doctor to send the people, or you're working directly to the patient, or you're talking to the doctors about?
That's a good question. The way I can explain it to you is that we've been working with ultrasound for 25, 30 years. And it has not been adopted into general urogynecology practice, mainly because the providers don't have the knowledge to use it. So now that we have technology like AI that can do some of the work for them, now the technology is going to disseminate. So I think the the change of knowledge and change of practice just takes time and education. So we, in terms of ultrasound, I've been giving talks like this anywhere that I've been invited, educating as many people as we can, whether they're providers, and I give talks to the patients, we give talks to everyone. So, and then you just have to find believers, people that believe in what you say is true, and then they go and talk to more people. So the uptake will be slow, but I think we're in a situation right now where the patients actually, because they're on social media, they know more and they demand more than what the providers are offering. So they go to you and say, no, this is not what I am looking for, I'm going to see somebody else.
Yeah, this is our dream, We had the dream to do this multidisciplinary stage because we know that that area that we work, there's other specialists. Mm-hmm. So we try to get together and do the first diploma in Latin America. And this is the idea. Mm-hmm. Getting people can get connected with that idea and start working together, no?
Mm-hmm. I think what you have done here has been really amazing. I want to congratulate you putting a summit together. I know it's a lot of work. But I think, again, people have been here learning from each other, learning about colorectal issues, urological issues, and just really seeing what other people are working on in silo. So talking to each other in this kind of more intimate setting is really important than being, in bigger meetings where you are not seen or heard.
So this is the first summit we are doing, multidisciplinary level. So what is your feedback about the level of these talks? Because I think most of the professors has given the talks a high level. So what do you think? What do you feel this thing should be still doing in this area?
Well, I think we talk about what we are comfortable talking about, and me personally, I never dumb things down. I always talk at the higher level, so for people to know where the ceiling is. And I think that's just like, being in a school. You don't want to be in a class where they teach to the lower denominator. You want to be in a class that they're teaching to the highest denominator, so you know where the ceiling is.
Last question is, what can you tell the people maybe they are getting some interest in this area, should come and join and start working in this area?
Well, I think actually people who are in this area, they would come. They would be very interested in a summit like this. They just don't know about it. So I think a lot of meetings like this, once you do it more and more years, and it just becomes normal that this thing is going to happen, more people will join to benefit from it.
Thank you very much.
You're welcome.
So we are very happy having you over here. So you're one of our mentors, We follow, a lot of people follow you. So most of the things that you talked about to the lecture is in your book. Mm-hmm. So if anybody interested in the book, it's available.
Yeah.
And once again, thank you very much.
You're welcome. Thank you for having me with you. I really appreciate it.